Hello, my name is Nate Hellinger, and this is my presentation on schema therapy for patients with dissociative identity disorder. This is a case report. So, some introduction for our topic. So, what is DID? So, DID is dissociative identity disorder. It is often misdiagnosed. This is because it has a lot of similar symptoms to PTSD and some other childhood trauma responses. It also has some similar symptoms to schizophrenia. So it's often kind of misdiagnosed because these are much more popular, much more known conditions and disorders to be diagnosed with. So it's tricky to get diagnosed with specifically dissociative identity disorder. And kind of what is schema therapy, as we're going to talk about in a little bit. First off, schema therapy is a psychotherapeutic approach to focus on childhood trauma. So schema therapy is a type of psychotherapy that aims to identify and change deeply ingrained negative patterns of thinking and behavior. So what is schema therapy? So schema therapy is considered a coping mechanism, but even farther back than this, what is schema essentially? So schema is kind of easiest to break down as an event and kind of an experience in someone's childhood or their past. So a schema kind of is characterized, a metaphor for schema, is a filing cabinet. So think of your brain as your filing cabinet. Think of each event as your schema, or kind of a file that goes into your filing cabinet. So you kind of take example like a birthday party. So every time you go to a birthday party, it's put into this birthday party kind of notion, kind of schema folder. So essentially now every time that you go to a birthday party, it's put into this folder, and every time that you need to talk about or go to a birthday party or know how to act at a birthday party in the future, you pull from this file, from the schema, to kind of know the information that you need to know. So how do you act at a birthday party? What do you bring to a birthday party? What do you wear to a birthday party? These are all pieces of information that you've learned from past experiences and from information that you've gained from this. Now, you need to know how to act at a birthday party. You need this file because that's different necessarily from, say, a funeral. So a birthday party is a celebration of somebody's life and somebody aging for another year, while a funeral is a celebration of somebody's life kind of as a memoir almost. So you need to know that these are different events. You need to know how to act, you need to know what to wear. Maybe instead of bringing a gift to a birthday party, you bring flowers to a funeral. You need these in separate files, separate schemas, so that you can know how to act. You can rely on this information that you've learned in the past to then use that for the future for these events coming up. So over here on this side, we have kind of some schema therapy. These are popular kind of nodes that the theory of schemas have been categorized into. We're going to talk about these in a little bit here. But you have kind of your avoidant protector roles, kind of your childhood roles, and everything in between. So let's get into some of the background specifically for our case report. So the case report that we're going to talk about in a minute here is about a woman named Ella. She is a 43-year-old female patient with DID. She has depressive disorder. This is a recurrent type. She has PTSD and also is a habitual cannabis user. She also has BPD, which is borderline personality disorder. That's just information about her that we're going to talk about in a second here. And then there are 3 phases to DID. So to schema therapy for patients with DID. This is your symptom stabilization phase, your trauma processing phase, and then your identity integration and rehabilitation phase. So it's also pretty important to note here, kind of aside, a little bit of information here that we're going to talk about. DID is a highly disabling disorder. It's associated with high levels of impairment, high risk for self-harm, and multiple suicide attempts have been kind of categorized for people who have this disorder. It has a high mortality rate because of this, and has very high societal costs. So this is information that's important to note for people with DID. The percentage of patients that reach the 3rd phase is relatively low, that we're going to talk about in a minute. The treatment duration is long, and the effects of treatment on core symptoms and experiences have been found to be small or absent, which leaves a lot of improvement that we're going to talk about kind of later on. So let's get into this next stage here. But before we do, we need to just kind of discuss that the treatment for DID, like we said, is often a practice-based psychodynamic, psychotherapeutic approach that conduct in the 3 phases, and the percentage of patients who've reached the 3rd phase, which is your identity integration and rehabilitation, is relatively low. It's at 17 to 33% kind of patients who reach this 3rd phase, so that's a pretty low percentage relative to the case study or the sample size that we start with, and that's just because of how long this treatment takes. 8.4 years to get through this entire, or averaging 8.4 years to get through this entire approach. So it is a lengthy process. This is not something that you can usually work with one therapist for. This is something that you have to go in multiple times a week for multiple hours to go through multiple years just to kind of get some results that we're going to talk about in a little bit here. So there's an estimated 12 months prevalence of DID. It has a 1.5% in general American population and is around 5% in a psychiatric setting. The effectiveness of this treatment has been examined in several non-controlled studies and 1 randomized controlled trial. The results indicate that although the general functioning of patients improved, the effects of this treatment on its core symptoms, so specifically dissociative disorders, are small or absent. Hence, there is ample room for improvement for this treatment of DID. So let's meet Ella. Ella is the person that they followed this entire study around. There are several different patients that they followed it around. There's 10 total, but they chose Ella to kind of break down a lot of the information that we're going to see here today. So she is 43. Ella is a fictitious name, and this photo is something I just had AI generate. So this isn't actually what she looks like. This is a disclaimer, and Ella is not her real name, just as a disclaimer. So I'm going to read off. This is going to be kind of some lengthy information here, but it's important to note that for the information that we're going to talk about in a little bit here. So Ella is a 43-year-old patient with extensive psychiatric history. She was referred to by a specialist mental health center in the Netherlands to participate in this study and for her treatment of DID and psychotherapy. So Ella experienced nightmares, flashbacks about past traumatic events, experiences, and reported 17 different identities, as well as dissociative amnesia, which is memory gaps kind of on your day-to-day life because of past trauma. Several identities are obsessed with self-hatred, self-punishment, and she repeatedly had given orders, or she's been repeatedly received orders from these alternative personalities to commit self-harm, self-punishment, and repeatedly gave orders to hurt or kill herself. She broke her arm once by force, has repeatedly cut herself on the arm, and attempted suicide several times. According to the patient report, the traumatic experiences involved are a lot of childhood abuse, some sexual abuse by her father multiple times, and as well as a teacher and a peer in secondary school. Her mother additionally denied the abuse and behavior and perceived this in a guilt-inducing way, which made Ella feel like the actions that happened to her were her own fault through her own actions. Moreover, during her training as a dentist assistant after graduating from high school, a manager had sexually abused her, which brought these symptoms back to the forefront, which created a mental breakdown, where she was then hospitalized numerous times, diagnosed with multiple different disorders, and had multiple suicide attempts. She was also she had treatment focused on depressive and anxiety symptoms because of her suicidal attempts. This is where she started using cannabis habitually. She was delivered in an individual as well as a focused format and did not result in a long-lasting result. So previous treatment in this case did not include trauma stabilization, which could have had some effects later on for the schema therapy specifically. And it's also lastly important to note that she met her husband 14 years ago and has a son who is 6 years old. She feels insecure about her upbringing for her son and feels unconnected to her partner. And at the start of her therapy, she was unable to work and is one of 10 patients in this study. I know that's a lot of information, but that's important to kind of break down as we talk, or that's important information to have as a background as we talk about Ella and the treatment that she went through going forward here. So her goals going into this were to, one, obviously become more capable as a host personality, we use in quotes, and kind of be able to relate more and stay in control more of her personality, as well as relate more to her husband and be a better parent and have a better upbringing to her son. So this graph is going to be kind of hard to see on the video. I apologize for that, but this is a graph of 17 different personalities that Ella has, all alternative to her host personality, as well as they're numbered here on the side, 1 through 17. Here we have the age of the personality, the behavior associated with that, what the behavior is trying to accomplish, and what triggers this personality switch here, the feelings and needs associated with this, as long as the schema therapy node here listed on the side. So we're just kind of going through some of this information. You have kind of the triggers that, like what kind of feeling, like an overwhelming long-term feeling that she might experience, that would cause a switch to a different personality. So for example here, you have a lot of loud voices, a lot of anger. She's experiencing a lot of anger. That's going to kind of result in a need for safety and a lack of feeling within Ella as a person, which then switches her to her personality here, listed as the name M. Each personality has a different name associated with it. This personality has no doesn't have an age associated with this personality, but its goal is to prevent mistakes, avoid punishment, because she's associating this with like a loud, angry, it says here specifically a man's voice, a loud, angry man's voice. So she's going to switch to this personality, which is kind of like a punisher personality, to protect her from the experience that her brain has associated from the schema from earlier in her life, that she is now kind of from her schema filing, she has associated loud, angry voices with getting punished. So she's created this personality to then prevent that from happening. Kind of like a protector personality, one could categorize that as opposed to necessarily down here, you have a personality named S, who has an age of 5 years old. So this personality is kind of a fearful personality, which has a need for safety. So she would switch to this personality when she's in a great state of fear, switch to this personality and for her body to find safety and protection. This is a 5-year-old personality, like I said, so the point of this personality is to create kind of an innocent kind of time where she didn't have some of this trauma in her life, so her brain is reverting back from a stressful situation to a time where she was innocent, to a time where she didn't have a lot of these issues and a lot of these memories that she has now. So I think it's pretty interesting that there are not just 1 or 2 of these protective personalities, but 17. And alternatively, they have a lot of different ages. Some are male personalities, some are female personalities. Kind of the ages range here from 5 years old to 51 years old, which is another angry, loud voice personality, which is associated with anxiety, which Ella would switch to when she needs a safe kind of environment to provide her brain some rest. This is a personality that is trying to kind of make things happen, it says. So that could be kind of a protector as well as somebody who just puts things into action. So if she's feeling scared, she's feeling fearful, she kind of switches into this personality, and instead of kind of like hiding away, kind of curl up to a ball, kind of that personality, this personality would be the aggressor, the aggressive one in this situation. So the goal would kind of be to prevent any trauma the goal of this personality would be to prevent any excess trauma, any excess situations that would kind of add to her condition. So the goal would be to kind of shut all those down and be the aggressor as a whole in this traumatic situation that she finds herself in. So what is schema therapy? How is this going to work? So schema therapy, like we talked about earlier, is specifically for DID patients, is about an 8.5-year almost kind of therapeutic approach. So schema therapy is a psychotherapeutic approach that helps individuals identify and change unhealthy, self-defeating behavioral patterns rooted in childhood experiences. So these are your schemas. So your brain is relating back to an experience that it gathered information from, that it's going to use to provide information for future experiences. So like in Ella's case, she has a traumatic experience from her past. Her brain is going to take this information of the situation that she's in, that she associates the situation with trauma and whatever the outcome that may have for her. Then she's going to use that and kind of her brain is going to base this situation that she's on now. So this involves a lot of therapy, a lot of figuring out what these experiences specifically are. This is, like I said before, almost an 8.5 year kind of therapeutic approach. So this isn't something that just happens overnight. You've got to keep in mind that these are experiences that this person, in Ella's case, has been experiencing for 43 years of her entire life. So these are not easy chains to break. This is the brain coping with past traumatic, extremely traumatic events. So these are not easy neural pathways to break, not easy new habits to form, and not easy coping mechanisms to break down and create new coping mechanisms for her. So what was the purpose of this study? So the current study sought to investigate the impact of alliance on treatment outcomes for DD patients, which is just dissociative disorder patients as a whole. So this experiment tested the effectiveness of schema therapy specifically on patients with dissociative identity disorder and other dissociative disorders as a whole. So the methods that we use, the methods that were used in this study consisted of 160 sessions done twice a week, followed by a 40 weekly sessions. So this totaled out to be 100 in total weeks, which lasts about 2.5 years almost. It is important to understand each personality and its role that it has for the host personality. So this isn't like I said, a quick process. This is something that's going to take a lot of time. You need a lot of resources to be able to work through this. So this is a lengthy process. So talking about some of the results from this study. So you see a lot of your results kind of early on in this treatment. Obviously, it's going to be the quickest, and then the later years in the study are going to be kind of finalizing these coping mechanisms and pathways that we work on within the first year. So the first 6 months, after the first 6 months, patients were able to stop using cannabis and other coping mechanisms that they had found on their own. They were then able to implement and start practicing some of their new coping mechanisms from the schema therapy that therapists worked on with these patients. After about a year, patients were able to stay present as the quote-unquote host personality during the majority of their day. And when they did feel themselves switching because of strong emotions, they were able to use these coping mechanisms from the first year that they had established, and they were able to try to prevent these switches from happening in the future. So obviously this isn't perfect. The majority of the work came from this first year, and the other however many years this took for these patients, which averaged about 7 years after this one, were aimed at just practicing these coping mechanisms and working on them in the future to make them as cemented pathways in the brain. So it's important to note that there is no cure to DID. However, patients can learn to coexist with these other personalities. Though treatment, patients can learn new coping mechanisms, lower the number of manic episodes, and thoughts of self-harm that they face. So also something that I found was interesting about the study as a whole was after following Ella, she found it was really difficult after her schema therapy. She found it was really difficult to kind of leave some of the people that she's worked with behind. I think this is really interesting because they worked for 8 years with Ella specifically. Both the people who were researching her and her therapist. This is obviously kind of like a second half in her life where she's now met her husband, she has a child for less time than she's been working through this schema therapy. So this is obviously something that's integrated very well into her life, and something that's definitely going to be difficult to let go. So there is a fear that some of these coping mechanisms might fall off. However, it also is important to note that the therapist isn't going anywhere. They're just not meeting once a week anymore. They still are not meeting once a week mandated by schema therapy now. They're going to use schema therapy in the future, I would assume, but they're not now mandated to these weekly sessions. So Ella reported that schema therapy for dissociative identity disorder was and is still hard work. She has learned tools that she can use to keep moving forward and take control over moods and flashbacks. Where she used to avoid many situations and places, she now has the confidence to know that she can manage her life on her own without her therapist. This was a quote directly from the study, directly from Ella. So a little bit of discussion. Like I said, she found it pretty difficult to say goodbye to her therapist. And due to the descriptive nature of this case report, there were no conclusions that can be drawn about the evidence base for schema therapy, for DID specifically. Follow-up assessments were performed but cannot be presented because this case is a part of a non-concurrent multiple baseline design for 10 total patients, which is not yet finished. So the results of individual patients can't be shared, and it's difficult to kind of go back and forth between the different patients and their results because each patient is obviously different. Each case is a case-by-case basis, so it's difficult to kind of have like a ideal kind of model that you want to use when you're working with 10 patients who have completely different childhood trauma and past traumatic events. And it's also pretty difficult because a lot of these symptoms, like we talked about, are misdiagnosed or underdiagnosed because it's so similar to schizophrenia and so similar to PTSD. And these are obviously much more popular, or not popular, but well-known kind of disorders. So it's easy to kind of assume for doctors who don't know the specific signs to diagnose these patients with these other disorders. So wrapping up all of this information here. So this case report shows that schema therapy can be applied to dissociative identity disorder patients and suggests that the possible effectiveness for schema therapy for DID in general is important, an important next step is to systematically investigate the effectiveness of schema therapy for DID in the methodology and well-designed treatment studies, possibly leading to an evidence-based treatment that goes beyond stabilization for symptoms. So kind of talking about the results a little bit more here, but it's important to note that the patients who went through this treatment and have finished it have all reported great signs for their treatment and coping mechanisms in the future. Like I said, there is no cure, but going through schema therapy has helped these patients tremendously, as it said in the report. So this is something that they definitely want to kind of look at going further on with some more studies and find a way that they can kind of compare schema therapy as opposed to other types of therapeutic approaches that could work for people with DID. And the very last thing that we're going to say here is the statement of ethics that was provided in this study. So the study involved human participants that were reviewed and approved by the ethics committee of the Faculty of Behavioral and Social Sciences at the University of Groningen. The patients and participants provided their written informed consent to 1, have schema therapy, or to use schema therapy, and to 2, participate in this study. So there was written and informed consent obtained from the individuals for the publication of any potential individual images or data included in this article. And lastly, I'm just going to open up to any questions here. So Dr. G, if you have any questions for me, please feel free to ask me. Please email me, or whenever I see you on Monday, please feel free to ask. So thank you so much, and I appreciate it.